Medical Assistant Exam Clinical Procedures Questions. Question 1. When a patient encounter unfolds in a women's health clinic, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, ventricular filling with blood only. Option B, atrial repolarization only as the visible main event. Option C, a lung gas exchange. Option D, ventricular depolarization. The correct answer is option D, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Gas exchange occurs in the alveoli, not on the QRS waveform. Question 2. Given the workflow in a same-day appointment, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A, prepare the skin according to protocol to improve electrode contact. Option B, wet the electrodes with tap water only. Option C, place electrodes over clothing. Option D, ignore loose electrodes if the tracing prints. The correct answer is option A, prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Unapproved moisture does not replace proper skin preparation. Electrodes must contact skin to record electrical activity. Loose electrodes can create artifact and poor quality results. Question 3. As part of exam preparation in a patient intake station, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A, place 2 or 3 fingers over the radial artery at the wrist. Option B, count respirations before locating the pulse. Option C, place the stethoscope over the abdomen. Option D, use the thumb to feel the pulse. The correct answer is option A, place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. Respirations are measured separately and do not identify the pulse site. The abdomen is not used for a routine radial pulse. The thumb has its own pulse and can interfere with accurate counting. Question 4. As part of exam preparation in a busy front office, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, patient reports sharp right ear pain for 2 days. Option B, ear infection diagnosed today. Option C, right ear normal after exam. Option D, patient seems dramatic about ear pain. The correct answer is option A, patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. A diagnosis should not be documented by the assistant unless the provider has made it. Exam findings belong to the provider and are not the chief complaint. Subjective judgment is unprofessional and not appropriate for the medical record. Question 5. Given the workflow in a clinical skills review, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, the assistant's diagnosis before the visit. Option B, only the patient's favorite pharmacy color. Option C, another patient's insurance card. Option D, demographics, contact information, insurance information, and reason for visit. The correct answer is option D, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. That information does not complete registration. Insurance information must belong to the patient being registered. Question 6. At the start of care in a women's health clinic, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A, the pulse oximetry reading will be inaccurate. Option B, the blood pressure may read falsely low. Option C, the temperature will be elevated. Option D, the blood pressure may read falsely high. The correct answer is option D, the blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Cuff size has no direct effect on body temperature. Question 7. After reviewing the situation in a quality control review, An adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, abandonment. Option B, beneficence. Option C, respondeat superior. Option D, patient autonomy. The correct answer is option D, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Question 8. An office review in an administrative check-in area shows that the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A, speculum for pelvic exam. Option B, otoscope. Option C, spirometer. Option D, ophthalmoscope. The correct answer is option B, otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A vaginal speculum is not used to inspect the ear canal. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. Question 9. Following office protocol in a procedure setup, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, painful or difficult urination. Option B, difficulty swallowing. Option C, excessive thirst. Option D, ear inflammation. The correct answer is option A, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Difficulty swallowing is dysphagia. Excessive thirst is polydipsia. Ear inflammation is otitis. Question 10. For a patient encounter in a community health clinic, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, skip patient identification because the test is quick. Option B, puncture through visible dirt. Option C, use the first visibly dirty drop for every test. Option D, clean and dry the puncture site according to protocol. The correct answer is option D, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Patient identification is required even for quick point-of-care tests. Contamination can affect the sample and infection risk. Site contaminants can affect the first drop depending on protocol. Question 11. Before the visit continues in an infection control audit, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A, cancel the test because diabetes always prevents fasting labs. Option B, tell the patient to stop all diabetes medications without provider input. Option C, review fasting instructions and route medication questions to the provider. Option D, tell the patient fasting means no restrictions at all. The correct answer is option C, review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Diabetes requires careful instructions but does not automatically cancel testing. Medication changes can be unsafe without provider direction. Fasting usually includes specific limits on food and drink. Question 12. During a diagnostic testing area, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, wipe the surface dry immediately. Option B, use the disinfectant only on clean hands. Option C, keep the surface wet for the full listed contact time. Option D, dilute the solution more to reduce odor. The correct answer is option C, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Question 13. The care team in a phlebotomy station asks for guidance because a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, keeping sterile items above waist level. Option B, opening the wrapper away from the body first. Option C, using sterile forceps for sterile supplies. Option D, reaching across the sterile field with an unsterile sleeve. The correct answer is option D, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Sterile forceps can help maintain asepsis when used correctly. Question 14. At the start of care in a pediatric clinic, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, topical. Option B, otic. Option C, ophthalmic. Option D, sublingual. The correct answer is option D, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Topical medications are applied to the skin or surface tissues. Otic medications are placed in the ear. Ophthalmic medications are used in the eye. Question 15. When a patient encounter unfolds in a primary care office, a pain score is being collected during intake. Which approach is best? Option A, tell the patient pain is not part of vital signs. Option B, change the score to match the assistant's opinion. Option C, ask the patient to rate pain using the office's standard scale. Option D, assume pain level from facial expression only. The correct answer is option C, ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Pain assessment is commonly included in intake workflows. The pain score should reflect the patient's report. Facial expression alone may not reflect the patient's reported pain. Question 16. When a patient encounter unfolds in a primary care office, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, lock the wheelchair and use proper body mechanics with assistance as needed. Option B, leave the wheelchair unlocked for easier movement. Option C, pull the patient by the arms quickly. Option D, ask the patient to jump to the table. The correct answer is option A, lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Jumping is unsafe and unrealistic for a transfer. Question 17. An office review in a same-day appointment shows that a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, perform blind finger sweeps immediately. Option B, leave the patient alone until they stop coughing. Option C, give the patient food to push it down. Option D, encourage coughing and monitor closely. The correct answer is option D, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Food can worsen the obstruction. Question 18. An office review in a busy front office shows that a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, open the package and rinse the instruments. Option B, reprocess the instruments before use. Option C, write a new date on the package. Option D, use the instruments if the package is dry. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. A dry package alone does not override an expiration policy. Question 19. Following office protocol in a treatment room, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the left sternal border. Option B, left arm below the clavicle. Option C, fourth intercostal space at the right sternal border. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option C, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V2. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. Question 20. While working in a clinical skills review, a patient is placed lying face down for a back examination. Which position is being used? Option A, prone. Option B, Fowler. Option C, supine. Option D, lithotomy. The correct answer is option A, prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Question 21. When a patient encounter unfolds in a phlebotomy station, the term gastroenterology appears in a referral. Which specialty is involved? Option A, nervous system. Option B, endocrine glands. Option C, digestive system. Option D, urinary bladder only. The correct answer is option C, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Neurology focuses on the nervous system. Endocrinology focuses on hormone-producing glands. Urology focuses on the urinary tract and male reproductive system. Question 22. While working in an urgent care office, a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 1 milliliter. Option B, 5 milliliters. Option C, 0.5 milliliter. Option D, 10 milliliters. The correct answer is option C, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 1 milliliter would provide 100 milligrams. 5 milliliters would provide 500 milligrams at this concentration. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. Question 23. For a patient encounter in a busy front office, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, count the pulse for a full 60 seconds. Option B, count for 10 seconds and multiply by 6. Option C, skip the pulse and record not available. Option D, use the patient's previous pulse from the chart. The correct answer is option A, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Short counts are less reliable when the rhythm is irregular. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Question 24. To protect safety in a telephone triage workflow, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, clean and dry the skin before applying electrodes. Option B, move all chest leads to the abdomen. Option C, apply electrodes directly over lotion. Option D, use tape only and skip electrodes. The correct answer is option A, clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Tape cannot record cardiac electrical activity. Question 25. While working in an exam room, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, safety data sheet. Option B, appointment reminder template. Option C, insurance remittance advice. Option D, patient intake form. The correct answer is option A, safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Reminder templates do not address workplace chemical safety. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Question 26. Following office protocol in a patient intake station, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the reading may be inaccurate. Option B, the patient will automatically faint. Option C, the pulse oximeter will stop working. Option D, the oral temperature will decrease. The correct answer is option A, the reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Question 27. Following office protocol in an administrative check-in area, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A, airborne precautions. Option B, contact precautions only. Option C, droplet precautions only. Option D, reverse isolation for staff protection only. The correct answer is option A, airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Droplet precautions do not address smaller airborne particles that can remain suspended. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Question 28. After reviewing the situation in a procedure setup, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, estrogen. Option B, thyroxine. Option C, melatonin. Option D, insulin. The correct answer is option D, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Thyroxine is a thyroid hormone involved in metabolism. Melatonin is associated with sleep-wake cycles. Question 29. To protect safety in a same-day appointment, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, speak louder and slower in English only. Option B, ask a young child to interpret. Option C, use a qualified medical interpreter. Option D, skip the explanation if the patient nods. The correct answer is option C, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Volume does not remove a language barrier. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Nodding does not prove understanding or valid communication. Question 30. The care team in an exam room asks for guidance because a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A, right insurance, right copay, right appointment, and right room. Option B, right diagnosis only. Option C, right color of vial and right storage shelf. Option D, right patient, right medication, right dose, right route, right time, and right documentation. The correct answer is option D, right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Administrative details do not replace medication safety checks. Diagnosis alone is not enough to confirm safe administration. Vial appearance and shelf location are not sufficient medication rights. Question 31. When a patient encounter unfolds in a community health clinic, a sterile package is torn before a minor procedure. Which action is required? Option A, spray the package with disinfectant. Option B, tape the wrapper and use the contents. Option C, consider the contents contaminated and obtain a new sterile package. Option D, use the items if they look clean. The correct answer is option C, consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Surface disinfectant cannot sterilize items inside a compromised package. Taping does not restore sterility after the barrier is compromised. Clean appearance does not prove sterility. Question 32. As part of exam preparation in a cardiology practice, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, use it after expiration if it looks clear. Option B, place it in direct sunlight to warm quickly. Option C, maintain required temperature storage and check expiration before use. Option D, store it in a desk drawer overnight. The correct answer is option C, maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Room temperature storage can damage refrigerated products. Question 33. The care team in a walk-in clinic asks for guidance because a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, premium. Option B, adjustment. Option C, deductible. Option D, copayment. The correct answer is option D, copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 34. An office review in a walk-in clinic shows that a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A. Have the patient walk quickly before the measurement. Option B. Measure only oxygen saturation while the patient is seated. Option C. Record the first seated blood pressure as orthostatic. Option D. Measure blood pressure and pulse in different positions according to protocol. The correct answer is option D. Measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. Exertion can distort the readings and increase fall risk. Oxygen saturation does not assess the blood pressure and pulse changes requested. A single seated reading does not show positional change. Question 35. Given the workflow in an urgent care office, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Prior authorization. Option B. Matrix blocking. Option C. Wave scheduling. Option D. Stream scheduling. The correct answer is option C. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Prior authorization is payer approval and is not a scheduling method. Matrix blocking reserves time unavailable for patient appointments. Stream scheduling assigns patients specific individual appointment times. Question 36. At the start of care in a certification exam scenario, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Automatic insurance approval. Option B. Better sterilization monitoring. Option C. Improved privacy protection. Option D. Loss of accountability for chart access. The correct answer is option D. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Question 37. An office review in a walk-in clinic shows that a patient needs crutch walking education after provider instruction. Which principle is important? Option A. The patient should skip follow-up if pain increases. Option B. Crutches should be used only on wet floors. Option C. Crutches should fit properly and not press into the axilla. Option D. Body weight should rest mainly on the armpits. The correct answer is option C. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Question 38. A medical assistant is working in a community health clinic when a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Cover it with loose papers. Option B. Place a warning sign and arrange cleanup immediately. Option C. Ignore it because it is not in an exam room. Option D. Wait until a patient reports slipping. The correct answer is option B. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Loose paper can worsen slipping and does not clean the hazard. Safety hazards matter throughout the facility. Prevention should occur before an injury happens. Question 39. To protect safety in a family practice clinic, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Tell the patient the provider will review and explain the results. Option B. Post the result publicly so others can comment. Option C. Diagnose the patient based on abnormal values. Option D. Change the results so it appears normal. The correct answer is option A. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Public disclosure violates confidentiality and professionalism. Diagnosis is outside the medical assistant's scope of practice. Changing results is unethical and falsifies the record. Question 40. While working in a pediatric clinic, a subcutaneous injection is ordered. Which site is commonly appropriate? Option A. Into an area that is bruised and inflamed. Option B. Deep into the deltoid muscle only. Option C. Abdomen with adequate subcutaneous tissue. Option D. Directly into a vein. The correct answer is option C. Abdomen with adequate subcutaneous tissue. Subcutaneous injections are placed into fatty tissue, and the abdomen is a common site when appropriate. Bruised or inflamed tissue should generally be avoided. The deltoid muscle is an intramuscular site, not a routine subcutaneous site. Intravenous administration is a different route and is outside a subcutaneous injection. Question 41. The care team in a telephone triage workflow asks for guidance because the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Record the respiratory rate from the last visit. Option B. Ask the patient to breathe as deeply as possible. Option C. Count respirations while the patient is unaware of the measurement. Option D. Count for 5 seconds and multiply by 12. The correct answer is option C. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Very short counts are often inaccurate for respirations. Question 42. While working in a family practice clinic, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Refuse to document relevant information. Option B. Assume all people from that culture act the same. Option C. Tell the patient the practice is foolish. Option D. Ask respectful questions and avoid judgment. The correct answer is option D. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Stereotyping ignores individual differences. Judgmental language damages trust and may prevent disclosure. Question 43. Given the workflow in a telephone triage workflow, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A. Trendelenburg is the only routine choice. Option B. Fowler position. Option C. Prone position. Option D. Lithotomy position. The correct answer is option B. Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing. Question 44. In a certification exam scenario, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A. The fingernail bed. Option B. Deltoid muscle when the medication and volume are appropriate. Option C. A reddened rash site. Option D. Inside a visible vein. The correct answer is option B. Deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. A vein is used for intravenous access, not intramuscular injection. Question 45. Following office protocol in a preventive care visit, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A. Lavender EDTA tube for serum. Option B. A red or gold serum tube. Option C. Gray fluoride tube for all serum tests. Option D. Light blue citrate tube for serum. The correct answer is option B. Red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Gray tubes are not the standard serum tube for routine chemistry panels. Citrate anticoagulant is used for coagulation testing. Question 46. While working in a preventive care visit, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Painful urination. Option B. Slow pulse. Option C. Rapid breathing. Option D. Low temperature. The correct answer is option C. Rapid breathing. Tachy means fast, and near relates to breathing. Painful urination is dysuria. Slow pulse is bradycardia. Low temperature is hypothermia. Question 47. To protect safety in an outpatient laboratory, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A. Centrifuge. Option B. Otoscope. Option C, ophthalmoscope. Option D, reflex hammer. The correct answer is option C, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A centrifuge separates specimen components and is not an eye exam tool. An otoscope is used for the ear canal and tympanic membrane. A reflex hammer tests reflexes and does not visualize the retina. Question 48. Given the workflow in a clinical skills review, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, remittance address. Option B, copayment. Option C, referral. Option D, coinsurance. The correct answer is option D, coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A copayment is usually a fixed amount rather than a percentage. A referral is permission or direction to see another provider. Question 49. Following office protocol in an infection control audit, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, use powdered latex gloves because they are easier to put on. Option B, ignore the allergy if the procedure is short. Option C, tell the patient to bring personal gloves only. Option D, use latex-free supplies and clearly communicate the allergy. The correct answer is option D, use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Latex gloves can trigger a reaction in a latex allergic patient. Even brief latex exposure can cause a serious reaction. The clinic remains responsible for preparing a safe care environment. Question 50. Before the visit continues in a cardiology practice, a patient falls in the exam room. Which action is best? Option A, call for help and assess for injury before moving the patient. Option B, pull the patient up immediately. Option C, hide the incident if no one saw it. Option D, tell the patient to drive home without evaluation. The correct answer is option A, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Moving the patient before assessment can worsen an injury. Falls must be reported and documented according to policy. The patient should be assessed before leaving. Question 51. Given the workflow in a walk-in clinic, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A, skip precautions if the patient is already taking medication. Option B, apply droplet precautions and offer a mask according to protocol. Option C, place the patient beside an immunocompromised patient. Option D, use only sterile gloves without a mask. The correct answer is option B, apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Treatment does not remove the need for appropriate precautions. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Question 52. For a patient encounter in a patient intake station, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, blood pressure and temperature. Option B, oxygen saturation and pain score. Option C, height and weight. Option D, pulse and respirations. The correct answer is option C, height and weight. Body mass index is calculated from height and weight. Blood pressure and temperature do not determine body mass index. Oxygen saturation and pain score provide different clinical information. Pulse and respirations are vital signs but are not used to calculate body mass index. Question 53. A medical assistant is working in a patient education session when a patient says they cannot afford a prescribed medication. Which response is best? Option A, ignore the comment because finances are private. Option B, tell the patient to stop all medications. Option C, notify the provider or appropriate staff so alternatives can be discussed. Option D, suggest sharing medication with a friend. The correct answer is option C, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. The concern directly affects care and should be addressed respectfully. Stopping medication without provider guidance can be unsafe. Sharing prescriptions is unsafe and inappropriate. Question 54. In an exam room, a peak flow test is ordered. Which body system is being assessed? Option A, integumentary system. Option B, skeletal system only. Option C, respiratory system. Option D, urinary system. The correct answer is option C, respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The integumentary system involves the skin, hair, and nails. Peak flow does not measure bone structure. The urinary system is assessed with urine tests and related procedures. Question 55. In a patient education session, the provider discusses the function of white blood cells. Which role is most accurate? Option A, help defend against infection. Option B, produce insulin in the pancreas. Option C, carry oxygen as their primary job. Option D, store bile for digestion. The correct answer is option A, help defend against infection. White blood cells are immune cells that help protect the body from infection. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Bile storage is a gallbladder function. Question 56. When a patient encounter unfolds in an infection control audit, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, place the probe over wet nail polish. Option B, increase oxygen without reporting the finding. Option C, ignore the waveform and record the lowest value. Option D, warm the finger or choose a better perfused site. The correct answer is option D, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Moisture and polish can interfere with sensor performance. Medication or oxygen changes should follow provider direction and clinical protocol. An unstable signal should be corrected before documenting the value. Question 57. The care team in a treatment room asks for guidance because coordination of benefits is needed. Which situation does this usually involve? Option A, a patient has more than one insurance plan. Option B, a patient needs a sterile dressing. Option C, a patient has one cash payment only. Option D, a provider orders a throat swab. The correct answer is option A, a patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. Dressing supplies do not create coordination of benefits by themselves. One cash payment does not require multiple plan coordination. A throat swab order does not itself involve multiple insurance plans. Question 58. During a patient education session, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A, remove electrodes whenever symptoms occur. Option B, submerge the monitor in water. Option C, keep a diary of symptoms and activities as instructed. Option D, ignore the return time. The correct answer is option C, keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Removing electrodes can interrupt recording when data are most important. Water can damage the device and create safety risks. The monitor must be returned as scheduled for data review. Question 59. In a medical office workflow, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A, leave the tube unmixed until pickup. Option B, gently invert the tube the required number of times. Option C, shake the tube forcefully. Option D, open the tube and stir with a swab. The correct answer is option B, gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Question 60. Given the workflow in an exam room, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, reuse sterile gloves from a previous patient. Option B, reach across the field with unsterile clothing. Option C, open sterile supplies without touching the inner sterile surface. Option D, place sterile gauze on an unclean counter. The correct answer is option C, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Sterile gloves are single-use and patient-specific. Reaching over the field can contaminate it. An unclean surface contaminates sterile supplies. Question 61. Following office protocol in an infection control audit, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B. Hand washing is needed only before eating. Option C. Gloves completely replace hand hygiene. Option D. Alcohol sanitizer is always illegal in clinics. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Hand hygiene is required at multiple points in patient care. Gloves reduce exposure but do not replace hand hygiene after removal. Alcohol-based hand rubs are appropriate for many routine situations. Question 62. The care team in a preventive care visit asks for guidance because a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Tell the patient to stop immediately. Option B. Suggest using a friend's medication. Option C. Recommend doubling the dose instead. Option D. Refer the question to the provider. The correct answer is option D. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Directing medication discontinuation is outside the assistant role. Sharing medication is unsafe and inappropriate. Changing a dose without provider order is unsafe and outside scope. Question 63. Before the visit continues in a telephone triage workflow, a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Use the meter because patient samples are different. Option B. Resolve the quality control problem according to protocol. Option C. Record patient results without documenting controls. Option D. Change the patient's diagnosis to match the meter. The correct answer is option B. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Failed controls must be addressed before reporting patient values. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Question 64. The care team in a cardiology practice asks for guidance because the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A. Provide appropriate draping and expose only the area being examined. Option B. Leave the patient uncovered until the provider arrives. Option C. Discuss the patient's body in the hallway. Option D. Skip explanations because the patient signed in. The correct answer is option A. Provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Unnecessary exposure reduces dignity and comfort. Public discussion can violate privacy and professionalism. Patients still need respectful communication during preparation. Question 65. As part of exam preparation in an urgent care office, a patient makes a complaint about care received in the office. Which response is most professional? Option A. Post the complaint online for staff opinions. Option B. Delete documentation related to the complaint. Option C. Listen respectfully and follow the office complaint process. Option D. Argue until the patient stops complaining. The correct answer is option C. Listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Publicly sharing patient concerns can violate confidentiality. Destroying or altering records is unethical and may be illegal. Arguing escalates conflict and is unprofessional. Question 66. As part of exam preparation in a phlebotomy station, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Apply lotion instead of cleaning hands. Option B. Place the gloves in a regular drawer. Option C. Perform hand hygiene. Option D. Use the same gloves to clean the next room. The correct answer is option C. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Lotion does not replace hand hygiene. Used gloves are contaminated waste and should be discarded properly. Gloves are task-specific and should not be reused between patients or areas. Question 67. The care team in a medical office workflow asks for guidance because a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Remove the band so it does not worry the patient. Option B. Ignore the band if the patient seems healthy. Option C. Verify the allergy information in the record and with the patient. Option D. Give medication first and ask about allergies later. The correct answer is option C. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Allergies must be checked before administration. Question 68. As part of exam preparation in a patient education session, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Lie flat immediately without assessment. Option B. Pack the nose with contaminated gauze. Option C. Sit upright and lean slightly forward. Option D. Tilt the head far backward. The correct answer is option C. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Contaminated materials should not be inserted into the nose. Tilting backward can cause blood to drain into the throat. Question 69. For a patient encounter in an outpatient laboratory, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A. Ask another assistant to do it secretly. Option B. Document that the patient requested it and proceed. Option C. Clarify the concern and follow legal scope of practice requirements. Option D. Perform it because any provider request is automatically legal. The correct answer is option C. Clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Passing on an improper task does not resolve the legal issue. Patient request does not override scope of practice limits. Delegation does not make a prohibited task legal. Question 70. At the start of care in a specialty referral visit, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask a family member to confirm the name only. Option B. Label the tube after returning to the lab. Option C. Use the room number because it is faster. Option D. Ask the patient to state 2 identifiers and compare them with the order. The correct answer is option D. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A family member may be mistaken and 1 identifier is not enough for positive identification. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A room number can change and is not considered a reliable patient identifier. Question 71. Before the visit continues in an exam room, a pelvic examination is scheduled. Which patient position is commonly used? Option A. Trendelenburg. Option B. Lithotomy. Option C. Sims. Option D. A prone. The correct answer is option B. Lithotomy. The lithotomy position is commonly used for pelvic examinations. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Sims position is often used for rectal procedures or enemas. Prone means lying face down and is not the common pelvic exam position. Question 72. Before the visit continues in a procedure setup, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Packaging instruments makes cleaning unnecessary. Option B. Organic material can interfere with sterilization. Option C. Sterilization is the same as hand washing. Option D. Disinfection always destroys every spore. The correct answer is option B. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Packaging dirty instruments traps contamination rather than preparing them safely. Hand washing reduces microbes on skin but is not instrument sterilization. Disinfection reduces many organisms but does not reliably destroy all spores. Question 73. In a preventive care visit, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A. A promise that medication will be prescribed. Option B. The assistant's guess about the diagnosis. Option C. Caller identity, contact information, reason for call, and urgency. Option D. Only the caller's first name. The correct answer is option C. Caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Medication decisions belong to the provider. Diagnosis should not be guessed in a phone message. A first name alone may not identify the patient or issue. Question 74. During an exam room, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Prone. Option B. Supine. Option C. Fowler. Option D. Sims. The correct answer is option B. Supine. Supine means lying on the back facing upward. Prone means lying face down. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Question 75. To protect safety in a treatment room, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Blow on the site to speed drying. Option B. Allow the alcohol to dry completely. Option C. Draw blood while alcohol is still wet. Option D. Touch the vein again with an ungloved finger. The correct answer is option B. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Wet alcohol can sting and may affect specimen quality. Palpating after cleaning can contaminate the site unless proper technique is used. Question 76. The care team in a medication administration visit asks for guidance because a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Tell the patient the reading is probably wrong. Option B. Promise that the provider will not be concerned. Option C. Acknowledge the concern and explain the procedure in simple terms. Option D. Ignore the anxiety to avoid making it worse. The correct answer is option C. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Dismissing the result can reduce confidence and may be clinically misleading. Promising an outcome goes beyond the assistant role and may be inaccurate. Ignoring patient concerns can increase anxiety and weaken communication. Question 77. In an urgent care office, a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A. Gray tube. Option B. Light blue tube. Option C. Green tube. Option D. Lavender tube. The correct answer is option C. Green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Gray tubes are often used for glucose-related testing depending on protocol. Light blue citrate is used for coagulation testing. Lavender EDTA is typically used for hematology testing. Question 78. The care team in a cardiology practice asks for guidance because the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A. 1 mm per millivolt. Option B. 100 mm per millivolt. Option C. 10 mm per millivolt. Option D. 25 mm per millivolt. The correct answer is option C. 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That calibration would make complexes appear too small for standard interpretation. That value would greatly exaggerate waveform size. That value is not the common standard amplitude calibration. Question 79. Given the workflow in a quality control review, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A. The machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option B. The electrodes are used only to deliver medication. Option C. A movement can create artifact that makes the tracing harder to interpret. Option D. A movement changes the patient's blood type. The correct answer is option C. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Normal breathing is usually allowed, but excessive movement should be avoided. Electrodes detect electrical activity and do not deliver medication during a standard recording. Movement has no effect on blood type. Question 80. Following office protocol in a same-day appointment, an intradermal test is being prepared. Which description matches the route? Option A. Injection just under the epidermis to form a small wheal. Option B. Medication placed into the ear canal. Option C. Injection into deep muscle tissue. Option D. Medication swallowed by mouth. The correct answer is option A. Injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Ear canal administration is otic. Deep muscle injection is intramuscular. Swallowed medication is oral administration. Question 81. A medical assistant is working in a women's health clinic when a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Notify the provider and activate emergency protocol immediately. Option B. Tell the patient to drive home and rest. Option C. Schedule a routine follow-up for next week. Option D. Ignore the symptoms if the injection site looks clean. The correct answer is option A. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Respiratory symptoms and swelling require immediate attention. Potential anaphylaxis cannot be delayed for routine follow-up. Systemic allergic symptoms matter even if the injection site appears normal. Question 82. At the start of care in a diagnostic testing area, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A. Review the provider-approved instructions and confirm understanding. Option B. Create new instructions that contradict the provider. Option C. Tell the patient not to call if symptoms worsen. Option D. Avoid documenting that instructions were given. The correct answer is option A. Review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Instructions should match the provider's plan and office protocol. Patients should know when and how to seek help for concerning symptoms. Patient education should be documented according to policy. Question 83. In a diagnostic testing area, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Blood in the urine. Option B. Sugar in the blood. Option C. Protein in the stool. Option D. Air in the lungs. The correct answer is option A. Blood in the urine. Hematuria means blood is present in the urine. Sugar in the blood is described by glycemia terms. Protein in stool is not hematuria. Air in the lungs is not described by hematuria. Question 84. Before the visit continues in a women's health clinic, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A. Notify the provider immediately and follow emergency protocol. Option B. Tell the patient it is probably anxiety. Option C. Complete all paperwork before telling anyone. Option D. Ask the patient to drive to another clinic. The correct answer is option A. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Medical assistants should not diagnose the cause of chest pressure. Administrative tasks should not delay reporting possible cardiac symptoms. Potential cardiac symptoms should be handled through established emergency procedures. Question 85. For a patient encounter in a medication administration visit, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Sinoatrial node. Option B. Gallbladder. Option C. Ureter. Option D. Alveolus. The correct answer is option A. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. The gallbladder stores bile and is not cardiac conduction tissue. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. Question 86. After reviewing the situation in a certification exam scenario, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A. Coordination of benefits. Option B. Battery. Option C. Defamation. Option D. Emancipation. The correct answer is option B. Battery. Battery can involve intentional touching or treatment without consent. Coordination of benefits is an insurance concept. Defamation involves false statements that harm reputation. Emancipation relates to a minor's legal independence. Question 87. The care team in an exam room asks for guidance because a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, record height only because weight changes often. Option B, record the measurements using the unit required by the office protocol. Option C, use the parent's estimate if the scale is nearby. Option D, round weight to the nearest 10 pounds. The correct answer is option B. Record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Both height and weight may be needed for clinical assessment. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Question 88. As part of exam preparation in a family practice clinic, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, alveolus. Option B, platelet. Option C, axon. Option D, ureter. The correct answer is option C, axon. An axon carries nerve impulses away from the neuron cell body. An alveolus is a lung air sac. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. Question 89. An office review in an urgent care office shows that an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, begin CPR and use the automated external defibrillator as directed. Option B, use the defibrillator on a conscious patient asking questions. Option C, wait for the provider before starting any response. Option D, give oral medication before checking responsiveness. The correct answer is option A, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. Question 90. During a clinical skills review, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A, finish all remaining patients before telling anyone. Option B, hide the incident if there is no bleeding. Option C, place a bandage on the site and ignore it. Option D, wash the area and report the exposure according to protocol. The correct answer is option D, wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Delaying reporting can delay needed evaluation and follow-up. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Covering the wound alone does not address exposure risk. Question 91. While working in a pediatric clinic, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, tell the patient the exact diagnosis without provider review. Option B, file the result for review at the end of the month. Option C, discard the result because it is abnormal. Option D, notify the provider or designated clinical staff promptly. The correct answer is option D, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Diagnosis and interpretation belong to the provider. Delaying a critical result can put the patient at risk. Abnormal results must be reported, not discarded. Question 92. After reviewing the situation in a phlebotomy station, a used needle must be discarded after an injection. Which practice is safest? Option A, activate the safety device and place the needle in a sharps container. Option B, carry the needle to the front desk for disposal. Option C, recap the needle with both hands. Option D, place the needle in regular trash. The correct answer is option A, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Question 93. During a telephone triage workflow, A specimen must be protected from light after collection. Which handling method is appropriate? Option A, wrap the specimen in foil or use an amber container as directed. Option B, place the tube in direct sunlight to warm it. Option C, shake the specimen vigorously for 1 minute. Option D, leave the specimen uncovered at the front desk. The correct answer is option A. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Sunlight can degrade light-sensitive specimens. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Question 94. Given the workflow in a community health clinic, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. The assistant diagnoses pneumonia. Option B. Patient states, I have had a cough for 3 days. Option C. No documentation is needed for symptoms. Option D. Patient is definitely exaggerating the cough. The correct answer is option B. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Diagnosis belongs to the provider. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Question 95. During an outpatient laboratory, a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Provide instructions in the wrong language. Option B. Use only complex medical terminology. Option C. Use clear language and review the key points with the patient. Option D. Tell the patient to search online without guidance. The correct answer is option C. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Language mismatch can prevent safe understanding. Complex terms can reduce comprehension. Unguided online searching may provide inaccurate or confusing information. Question 96. During a women's health clinic, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Spray disinfectant and wipe it off immediately every time. Option B. Open the door to air out the room only. Option C. Clean and disinfect touched surfaces according to office protocol. Option D. Change only the paper on the exam table. The correct answer is option C. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Disinfectants usually require the manufacturer's contact time to work properly. Ventilation alone does not remove organisms from contaminated surfaces. The exam table paper does not address other touched surfaces. Question 97. Before the visit continues in a phlebotomy station, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Recheck using proper technique and report the finding according to protocol. Option B. Send the patient home to rest without notifying anyone. Option C. Tell the patient that hypertension has been diagnosed. Option D. Erase the value because it may worry the patient. The correct answer is option A. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Accurate documentation is required even when the value is abnormal. Question 98. As part of exam preparation in an internal medicine office, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Beneficence. Option B. Abandonment. Option C. Coinsurance. Option D. Assault. The correct answer is option B. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Beneficence means acting for the patient's good. Coinsurance is a payment-sharing insurance term. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Question 99. As part of exam preparation in a certification exam scenario, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Use medical jargon to sound professional. Option B. Ask only whether the patient has any questions. Option C. Give instructions as quickly as possible. Option D. Ask the patient to explain the instructions back in their own words. The correct answer is option D. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Jargon can confuse patients and reduce understanding. Patients may say no even when they misunderstand instructions. Rushing can reduce comprehension. Question 100. A medical assistant is working in a patient intake station when blood spills on an exam room floor. Which response follows standard safety practice? Option A. Use appropriate personal protective equipment and an approved disinfectant. Option B. Wipe the spill with a dry paper towel only. Option C. Ask a patient to avoid stepping on it. Option D. Cover the spill with an exam table paper. The correct answer is option A. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Dry wiping can spread contamination and does not disinfect the surface. Patients should not be involved in hazardous cleanup. Covering a spill does not remove or disinfect the hazard.